At Pinnacle Fertility, our goal is to fulfill dreams by building families. Pre-implantation genetic testing for aneuploidy, or Pgt-A, is one of the services commonly utilized by our patients who are undergoing in vitro fertilization, or IVF. PGT is the process of doing genetic testing on embryos before trying to conceive. This will allow you, if you are interested, to avoid conceiving with an embryo that has a chromosomal abnormality. The most common type of PGT used in addition to IVF is called Pgt-A. Pgt-A stands for Pre-implantation Genetic Testing for Aneuploidy, which is a test that checks the chromosomal status of embryos. Each normal cell in our body will have 46 chromosomes. The word aneuploidy means extra or missing chromosomes. This is what Pgt-A is testing for. Aneuploidy is common in embryos. When an embryo has an extra or missing chromosome, it is at high risk for failed implantation, miscarriage, or the birth of a child with significant health problems, depending on the specific chromosomal abnormality that it has. If you know that you are a candidate for other types of PGT, including Pgt-M or Pgt-SR, you will benefit from obtaining more specific information from your doctor about these unique types of PGT and how they work. By determining which embryo has the normal number of chromosomes and which do not, Pgt-A helps to identify the embryos that are most likely to implant and result in a successful pregnancy. Because Pgt-A can also identify a small number of chromosomal disorders that could occur in a baby, such as Down syndrome, it can also reduce the chance of having a child with certain chromosomal syndromes. In addition, Pgt-A identifies the chromosomal sex of the embryo, XX for a female or XY for a male, and this information is available for those who wish to have it before it is transferred to the uterus to conceive. Aneuploidy rate of embryos mainly depends on women's age and will significantly increase from less than 30% up to age 35 to more than 75% over the age of 42. In other words, the probability of having one euploid, or normal embryo from one tested embryo, will be 70% up to age 35, 63% at ages 35 to 37, 42% at ages 38 to 40, and 24% at age 41 to 42. After egg retrieval and fertilization of the eggs with sperm, embryos are grown in the laboratory for 5 or 7 days. Embryos, created through IVF or ICSI, develop from 2 cells, 4 cells, to 120 to 140 cells on day 5 to 7 after fertilization and are called blastocysts. At this stage, and under the microscope, an embryologist can differentiate between what cells will develop to become the baby from the cells that develop into the placenta. Only the very early placental cells are biopsied, without touching the cells which develop to the fetus, and screened for all 46 chromosomes. To do the biopsy, an experienced embryologist uses a laser to create a small opening in the hard shell of the egg or embryo and carefully removes about 5 to 8 cells from the outer layer of the embryo. This layer, called the trabectoderm, is the part of the embryo that will later develop into the placenta of the pregnancy. It is important to note, therefore, that no cells are removed from the part of the embryo that is developing into the fetus or baby. With highly skilled embryologists, like those we have at Pinnacle, the risk of damaging an embryo during the biopsy process has been shown to be non-significant, 1 to 4%. No long-term risks for the babies associated with the biopsy have been documented in some studies, although no large studies have been performed to examine the health of babies who were biopsied as embryos. By now, Pgt-A, when indicated, is a standard procedure, and hundreds of thousands of babies have been born after undergoing this type of embryo biopsy. After the embryo biopsy is complete, the embryos are safely frozen by the most advanced technique called vitrification and stored at the clinic. Meanwhile, the biopsied cells are shipped to an outside reference genetic screening laboratory where the Pgt-A testing is done. The testing usually takes about 2 weeks. When available, the Pgt-A results will be released to you and to the clinic. It will indicate the chromosomal status of each embryo. Embryos with normal results are considered suitable to transfer. If there is more than one embryo with normal Pgt results, your doctor or the embryologist will recommend a thaw order based on the embryo morphology, the day of freezing, day 5, 6, or 7, and gender when relevant. We encourage you to discuss with a genetic counselor any questions you may have about the Pgt results and to discuss with your doctor your preferred thaw order. Aneuploid embryos with an abnormal Pgt result and full extra or missing copies of one or more chromosomes would not be transferred. For a small number of embryos, which may have mosaic results, meaning some of the cells are abnormal while others may be normal, it is important to consult your genetic counselor and/or doctor about the specific chromosome finding, what it means, and whether the embryo is suitable for transfer or not. There is also a small possibility of an embryo receiving inconclusive results from the Pgt lab. In this situation, you will discuss with your doctor whether the embryo could be rebiopsied and retested. At this stage, you will also finalize how the Pgt abnormal results will influence the embryo storage plan. It is important to note that Pgt-A is a limited test that does not screen for all possible chromosome problems, genetic diseases, or birth defects. In addition, while Pgt, including Pgt-A, Pgt-M, and Pgt-SR may have a 2% or less error rate or rate of misdiagnosis, embryos with abnormal test results will not be transferred. If you have a family history of a possible genetic condition or questions about other possible genetic risks, you should talk to a genetic counselor and your doctor about other forms of Pgt that you can consider to address specific genetic risks. The decision of whether to have Pgt-A on your embryos is a personal one that may be influenced by the reason you are doing IVF, the ages of you and your partner, your specific chance to conceive with embryo transfer and how we may improve it, and other factors. The Pgt-A consent form has more detailed information about the process, and a discussion with your doctor can help you decide whether Pgt-A is right for you. We wish you success in your treatment and the delivery of a healthy baby.